So in imaging patients, there's quite a very important aspect of it, which is like more of like you're trying to control the amount of exposure, you know. So you're trying to control the amount of exposure, okay, the amount of radiation energy that is actually reaching the patient. So there's a way you can control it manually, there's a way you can control it automatically. So let's look at these two ways. So it's just all around you're trying to control this amount of radiation energy that is reaching the patient. Okay, so let me just hint on something. Okay, so I think we're good to go. So the control of this is basically there are two different ways, okay, and you're trying to look at how much of this radiation energy is reaching the patient. Okay, so the manual control now. So in manual control is depending on the knowledge of the radiographer. So the radiographer is trying to select all those technical factors, okay, exposure time, the density of the, or will I say, the amount of energy, that is reaching the patient. And this is depending on a lot of factors like the patient size, the part of body you want to examine or image, and the type of image that you want to get. So advantage is the radiographer, if they have the adequate knowledge, they are fully in control. Do you understand? And it's useful for unusual patient conditions where the radiographer has to now think. Do you understand? So but one of the limitations is it depends solely on the knowledge of the radiographer. If the radiographer is not fully armed with knowledge, they could actually miss it out. So about the automatic, this is the automatic, and the automatic has to do with they use radiation detectors. So they are built into the X-ray table or the world standards. So you have some detectors that they are the ones that will basically, they are sensing how much of the wave is actually reaching there. So if it is too much, they will alert you that it's too much. So it will now control the exposure time. It will stop the beam when it has actually gone outside the range, to stop the beam when it has gone outside the range. Advantage is it provides consistent image quality. Provides consistent image quality, reduces repeat exposures, helps to prevent those creeps. Things are just going out of hand but not that much, okay, so they always help in dictating that, so I think that's what we got. So it requires correct detector selection and positioning, okay, and you could actually miss it out. You could miss out, because it's actually a machine, so that's what we got for this. So it's very important because it protects the patient from too much exposures, okay, protects the patient from too much exposures.